Hi, good day. I'm Dr. Dean van Westhuizen, eye surgeon in Mbombela. So you've been booked for an eye surgery. I just want to talk you through some of the important things to consider and think about on your journey through surgery. First of all, eye surgery should not be a traumatic experience. Most eye procedures are not particularly painful. The recovery times are not very long. It really should be a pleasant experience. Before your surgery, we'll ensure that you've signed consent for the surgery. It's important to ensure that you understand what surgery you're having and the risks involved. So we'll always go through those with you. But if there is anything that is particularly concerning or you feel you are unsure of, please ensure to ask for further information. Before any eye surgery, it's important to remember that one still needs to fast, meaning that you need to be without food for at least 6 hours. If surgery is performed at 1 o'clock in the afternoon, 6 hours before that, you need to have your last meal. You can drink fluids, and when I say fluids, they must be clear fluids, like water, apple juice, grape juice. You must be able to see through the fluid for it to count as a clear fluid. And you can drink clear fluids up to 2 hours before the procedure. But then from 2 hours before the procedure, it's important that you have nothing to eat or drink in that time. Before the surgery, we will always give you a time to arrive at the hospital. Please ensure that you stick to these arrival times to ensure a quick and efficient experience through the hospital. It's also important to make sure before the fact that you know exactly where you're going. Make sure that you've checked the directions and you know exactly where the hospital is where you're going to be operated in. One always needs to get authorization and an authorization number from the medical aid. We will give you all the documentation, codes, etc. required to get authorization. But if you have any issues, please contact us and we will assist you with this process. Once you arrive at the hospital and before going into theatre, you will meet the anaesthetist. The anaesthetist is going to be responsible for doing your anesthetic. With most eye surgeries, we do the surgery using local anesthetic. That means that you are awake for the procedure, but that your whole eye is numb. You aren't able to feel. You may or may not be able to see depending on what type of anesthetic is given at that time. An intravenous line will be placed by the anaesthetist and you'll be given some sedation. While you are sedated, the eye block will be done. There are different types of eye blocks, but essentially they all require injection of some local anesthetic around the eye. Not into the eye, but around the eye, and those blocks cause the eye to be numb. It's important to remember that that block lasts from 4 to 8 hours. So even after the surgery, the eye can be very numb. Even part of the head and the face can be numb. So don't be surprised if even in the evening you feel that maybe part of your head is still numb. That can be normal and normally settles down by the next day. Because your eye is anesthetized for many hours after the surgery, it's important to be aware not to rub or scratch the eye as you won't be able to feel it. We do put an eye patch on the eye to prevent that and to protect the eye, but it's important that if your eye patch falls off or your eye feels itchy or scratchy, to really not to rub the eye in the early post-operative period, as with the loss of sensation, you can damage your eye. After you've had the eye block done, you'll be taken into theatre. In theatre, you will be awake and alert. You'll be able to hear the surgeon's voice, machines and staff. The face is cleaned and a drape is placed on, so the one eye will be covered. There is a drape over your mouth. We give nasal prong oxygen, or we ensure that there's some oxygen underneath the drape, so you do have fresh air. But some patients may feel a little bit claustrophobic. If you are claustrophobic, please let your doctor know to ensure that an alternative arrangement can be made. In some cases, a general anesthetic may be required if patients really struggle with claustrophobia. During the procedure, if you have any complaints or problems, if you develop a sore back, a sore neck, if you are itchy or need to cough or sneeze, it's really important just to let the surgeon know, and we can stop, make sure you get comfortable, make sure that we relieve any issue you have, and then we can continue the surgery. The operation is being done through a microscope, and so it's under a magnified view. So very small movements can have a big impact on the surgery. So it's important to stay calm, to lie nice and still, and if you have any issues, just to indicate to the staff that you have a problem. At the end of the procedure, we always place an eye patch on the eye. That eye patch you can leave on. It's not necessary to remove that eye patch. Normally, we remove that eye patch the following day at your post-operative visit. So that eye patch, which will be taped on the face, can stay on. The next morning, we will take it off. Overnight, there's no need to put eye drops in the eyes. So that patch can stay on. The eye drops all start the next day. So leave that patch on, and we will explain how to use the eye drops in the morning when we take that eye patch off the next day. Importantly is that you'll be given a prescription. That prescription will have all your post-operative medication on it. That medication only needs to start the next day in most cases. If you are able to get the medication on the day of the surgery, that's very helpful, as if you bring in your drops and your medication at your post-op visit, then we can ensure that you've got the right medication and explain exactly how to put the drops in the eye. As I said in the beginning, this shouldn't be an unpleasant experience. Most patients have a very good experience going through the process, and so I hope that you have a good experience, and we'll see you in theatre.